Hello, I am Bonnie and I will be playing the dental assistant.
Hi, I'm the doctor.
I'm Sydney and I'm going to be the patient.
And then I'm Alexa and I'm going to be the narrator. Mary is a 32-year-old woman coming in for her dental appointment complaining of a tooth pain.
Good morning, Mary. How are you feeling today?
I am very tired. This tooth pain has kept me up all night.
I'm sorry to hear that. Before the doctor comes in to look at your teeth, I'm going to ask you a few questions about your health history.
Okay, great.
Are you having other symptoms besides the tooth pain?
Now that you mention it, I have been feeling warmer than usual, and the pain in my tooth has been giving me outrageous headaches.
How long has this been occurring?
I would say about 3 days now.
Okay, do you have any allergies?
None that I know of.
Are you taking any medications or drugs?
No, I am not.
After going over the patient's health history, the dental assistant then proceeds to take her vitals. The patient's blood pressure is 128/79, heart rate is 110 beats per minute, and her respiratory rate is 20 breaths per minute. The patient's vitals are slightly high, but she's in overall good health with an ASA 1 rating. The doctor comes in to assess the patient.
Good morning, Mary. I understand you have been having some tooth pain for the last few days. Is that correct?
Yes, that's true.
Okay, it looks like your blood pressure, heart rate, and respiratory rate are slightly elevated. This is most likely caused by the pain you are in. Let's take a look at the cause of this visit.
Okay, sounds good.
It seems like you have a periapical abscess. We need to drain the pus and either do a root canal or remove all of the teeth. Which would you prefer?
I prefer a root canal.
Okay, Mary, go ahead and sit back up. I'm gonna have my assistant get all the proper equipment ready for your procedure, and I'll be right back. Sounds good?
Sounds good, thank you.
I have the proper tools here.
Okay, Mary, are you ready to get started? If so, I'm gonna go ahead and administer the anesthetic.
Yes, I'm ready for this pain to be gone.
The doctor instructs the patient to take a deep breath. Upon her exhale, the doctor administers the lidocaine. The lidocaine takes about 20 minutes to take its full effect. While waiting for the lidocaine to take effect, the patient begins to look uncomfortable.
My eyes and face are starting to itch.
Has this happened to you before?
It has happened to me once after an annual physical.
Were you given any shot during that visit?
No.
Okay, go get the emergency kit, please.
The patient was complaining of being warm as well as beginning to break out into hives, developing a rash around her mouth and cheeks. The doctor determines that the patient is having a delayed allergic reaction to the latex gloves that are being worn. Delayed allergy is that of which clinical signs and symptoms do not emerge for an hour or more, which is why the doctor wasn't able to identify the reaction immediately.
Okay, I have the oxygen, I have the AED, and emergency medications.
I'm gonna give you a histamine blocker to help with your discomfort.
Okay, I hope it helps.
We will need to terminate your procedure today and reschedule for a different day. We recorded a latex allergic in your chart, so this can be avoided at your next appointments.
Okay, thank you so much.
After 30 minutes of observation, the patient is beginning to feel better. At the doctor's request, the patient calls a family member for a ride home and is prescribed diphenhydramine to take over the next 2 days, as well as amoxicillin to control the infected tooth as the procedure was unable to be completed.